I swear, you are like the oxygen I need to survive. I'll be honest, love baby, baby, I am so upset. I want to chop your heart. I'm a little back and it's you, but I'm mega you. I'm a love one thing, me make a bad man on your back, innocent face, mango chase. The way you ride, I go die, you go break my bed on this place. And I love the way you walking, cause I wanna see your mama's place. Oh, 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 oh. Eh, baraka simba kataipanda. Eh, kata kata chambugana. Eh, ito vita kama ya komando. Shake a bit on my makula tongue. Touch your toes, shake for me, shake, shake, shake for me. Now hold your knees, shake for me, shake, shake, shake for me.
Tukapendana nikakuweka ndani, sasa vipi tena unaleta hayawani? Mimi na wewe inatokea enzi, heshima na busara pamoja na mapenzi. Vipi sasa unaleta ushenzi, kila kona ya mtaa unagawa mapenzi. Jina lile jina mama, jina wangu jina baby, mambo gani jina umefa, jina sasa mbona umeniacha? Jina lile jina mama, jina wangu jina baby, mambo gani jina umefa. Nimejifunza tokana na makosa, katupimi sitorudia kosa. Kwako wewe nilikanyaga nyoka, nionapojani mimi nashituka. Unababaika na fasila sushi, unaongwa bia mikuku na chipsi. Unawaona wema kumbe ni watushi, wakikupa mimba wanatoka baruti. Jina lile jina mama, jina wangu jina baby, mambo gani jina umefa, jina sasa mbona umeniacha? Jina lile jina mama, jina wangu jina baby, mambo gani jina umefa, jina sasa mbona umeniacha? Hii sina vime mwaja na via
Hai, Fiona, haduni mi yani ya?
Ziranela, ikumadani, agbadadra madola antipie war valesi. Odika, ekele, macho vile onurua desasi.
Mama Linda, isi jokele azini odika desiko. Nya yulu flu cap. Kondra maza munke familia madri ipie.
Anzire, ayo mantege war desiri.
Eje flu cap syrup kan ko susururi azingire yede ba wara deria mo kiki capsule e. Mi flu cap syrup azini capsule so pharmacy azini dokani aroni mi agenya enyeri akarbisi woro. Azo kilo dikale ekele onvora za ruedza onvo serpeti di pie kingandia derete. Flu cap area la mivle familia ni Kampala Pharmaceutical Industries ni flu cap ofoni National Drug Authority fetilembo flu cap Podirazur ni Azonder Kaideko Endre Daktari.
My name is Ochaya. Low power used to be a problem in my house. Madam would be working and suddenly the light goes off.
That they have been telling you about solar energy. You don't have to worry about load shedding, and you'll save money in the long run.
Hello, that day I decided to listen to this young man. I installed solar panels to provide power. I also connected it to the outdoor lights to keep the thieves away. Even though the solar system was expensive to buy, I am now saving money and I will continue to. This message is brought to you by the Ministry of Energy and Mineral Development with support from GIZ through the promotion of renewable energy and energy efficiency program.
Emilbo, you will not para. Anyway, you want to come here to the audience? Woma yote chafe kuparma bechum wabo wotu kama borni chikamu ya ARV make yade tumupio marama kwado kinu chikamu ya lembe enu cheke dongupe jera chichwami yot kom umikuwa parni monde di pajumagi kwa kutuo juiga kawoni dongwa laura lawan chikamu ya ARV kodi audience makago kodwa ma eni ko jub iwa 1 cm wot man komi kwa kare ni timu lembe mange malubre kupar majati miyot komi iwa kawoni dongwa gamu ya ARV mariki wa pidu ya dek man bende wase kukare megamu ya ARV kudi kabiri milo riyat makago kodwa kawoni dong kwa iwa yot magwe tuo juiga kare peruda rusum
wet kujara ti permiyot kum kite miromo kan no angoro yat pato juiga maber maromo kan tim
goi simu itongwe na bora tongwe no ario achel tongwe na ngwen abusiel nyoke chwal waraga iwi abora tongwe no mima nano ni nyang matoch kwenda eni jumukele uche kalpiyot kum kukony ni ai kudibang USAID
kakar gore tin umiro wa mot munu gore kawa cher munu wa kuja amiro ni unung mi pa Pepsi Cola amiro ni wachiru wa lo jimi wen mawa no itepeka aha in ka in amiro ni wa mor munu gore wachiru no, we'll chip on Pepsi, or your Pepsi must be put the milk near the Kipiradet, Nita Pekka, where the low soda, TV, Otoquid, T-shirt, Limoto, keep it smoking in my pole, easy for me Pepsi, Morka be Pepsi, Grancharo Pepsi, Monkey can manong for thing way. Jimmy went to you, Olobucheke.
Pepsi, for the love of it. Lafu pero lobo, jo makati ke di rotet manyen mefu, jo lunu tameti je kum di rotet manyen mefu, weki cha kajpa lufu bed maupong, kai pero bulu makati ke di rotet manyen mefu, unyo etike biachara mapuru chaka chaka, unyo biachara madori, kare ni merien jo choro, chone pipima yute Africa Challenge Uganda, weke betke gume berikin loloyo, makubi poko image mechiling mia chel matieni, metke mech mokena mapola ta, makonye don, yenye Heifa International Uganda Facebook ki Twitter pingit makwaro kit mechone kibene pilogo kiman yubme pieme ayute Africa Challenge Uganda akibot Heifa International yunyeme tichki NTV RSM East Africa Famnera ki Mastercard Foundation Ketlemia Nyiba Africa ayute Africa Challenge Uganda.
Go get your second dose at a public health facility near you. Join the movement of Ugandans that is not going back to the painful moment caused by COVID-19. We shouldn't go back. This message is brought to you by the Ministry of Health with support from USAID.
For any country to be safe from COVID-19, the World Health Organization recommends that 70% of its eligible population must be fully vaccinated. As of 10th June 2022, only 15% of the population above 18 years have been fully vaccinated. Hence, the Ministry of Health, together with its partners, has planned to hold a countrywide accelerated mass COVID-19 vaccination campaign starting on Tuesday, 21st June 2022. All eligible persons named below will have an opportunity to be vaccinated. Those who have never been vaccinated, those who received only one dose, this excludes those who received Johnson & Johnson vaccine, those that have completed 6 months since a full vaccination and are due for booster doses. Children aged 12 to 17 years who are accompanied by their parents or guardians. Vaccination services will be available at health facilities, outreach posts, and any other selected public places. Please note that all COVID-19 vaccines in the country are free, safe, and effective in preventing severe disease, hospitalization, and death. This message is from the Ministry of Health Uganda with the support from UNICEF and partners.
Yes, good evening, dear listener. You are tuned to Radio Party 94.5 FM, Peace of Christ for All. This is a talk show, and in the studio we are already 10 minutes past the hour of 7 p.m. In the studio I have a team who are from Koboko, officials from our local government division. Basically, we are going to be discussing about integrating existing projects into the government program. I have about 5 people here in the studio. For your questions and comments, I'll open my studio lines later on in the last 10 or 15 minutes of the show for you to call and ask your questions and areas that you need clarifications on. Our studio lines are 0393 273 2524. The SMS, our MTN is 0788 956494. Before we dive into actualities we'll be discussing here, let me give my guests an opportunity to introduce themselves to you, that is their names and their positions, such that we can begin discussing really what we are here to discuss. Yes, you're welcome.
Thank you, moderator. Good evening, listener. My name is Bako Stella. I am a project officer working with Partners in Community Transformation, PICOT. We are based in Koboko. Thank you for tuning in.
Thank you, Bako. Yes.
Good evening, listeners. You call me Bayogara Soul. I'm CDO from North Division.
You're welcome, Bayogara Soul. Yes.
Thank you, the presenter. Good evening to you, the listeners. My name is Vita Bashir. I am a community health advocate from North Division representing Triangle Ward. Thank you.
Thank you so much. Yes, madam, you're welcome.
Yeah, thank you, moderator. Good evening, listener. My name is Luke Julie. I'm a sub-county chief from Kuluba sub-county, Koboko district.
Yes, lastly.
Yeah, thank you. My name is Vincent Yoga. I am a community development officer from Loble sub-county, Koboko district. Thank you.
Thank you, listener. Basically, that's the team with me in the studio. This talk is running till the hour of 8 p.m. and we will be expecting your feedback on the comments and questions and areas that you need clarifications on. Let me begin with my first guest. That is, yes, Mrs. Bako Stella, the project officer, PICOT. Yes, you came here in the studio planning to talk about integrating existing projects into government programs. What are we talking about exactly? You're welcome.
Thank you, moderator. I think before I dive into that, I want to bring to the attention of the listener that we are from Partners in Community Transformation, actually that has sponsored this radio talk show to bring the officials to share with us the sustainability strategies in regard to one of the projects that we are implementing as an organization. PICOT is a local NGO. We are based in Koboko, our offices, and we have field offices in other districts. We operate in the entire West Nile region, and we are in the areas of health, livelihoods and skills development, education, environment, agriculture, among others. So today we've come here to talk about issues of governance, in one of the projects that we are implementing. That is the Legal Empowerment and Social Accountability Project.
Okay.
This project, we started implementing it in 2020, and it's ending originally this month of June. However, we have a no-cost extension that is running up to December.
Okay.
So in preparation to the end of the project, we want to ensure that all the beautiful things that the project has done should continue, because we've seen results of this project, and my leaders are here, they can testify. The basic outcome that was intended for this project was to empower community members, to demand leaders to give accountability, and also ensure that the services that are in the community level are delivered very well. And we did that by engaging communities through dialogues and sensitizations, where leaders have been taking lead to ensure that issues that are not to the satisfaction of the community are rectified through dialogue. There's no rumor in some of these sub-counties that we have worked in. In Koboko, we're in Kuruba, we're in Ilobule, and we're in North. Trust me, the changes that we have there, the improvements are quite unique, and many of these other sub-counties who have not been to are yearning to have us there. So we are saying, as an organization, we also have our own strategies to ensure that this project runs. Being an organization, we are running different projects. So we have committed to ensure that through our other projects that are running, we will be able to slot in some of these sensitizations, use the same platform to sensitize, to continue sensitizing the communities. We are blessed to have the local government in place that is actually a very robust system that is there and is very close to the communities. So we pledge that we will continue engaging the local governments to ensure that these projects continue in a way they can integrate some of these activities in their already planned activities, which I believe is very possible because this has worked, and the flexibility at that level also makes it very possible for us to ensure that the project continues the way it is. Yeah, we also have local structures in the communities that we've been engaging, so we believe they still have a lot to the knowledge that they have, they can still share with the communities. So basically, that's why today we are here. We want to give the leaders a chance to share with us what they have planned to do to ensure that this project continues beyond its lifetime.
All right, thank you. Yes, still to you. Who did you target with this project? And you talked about the project coming to an end soon, and you also pointed the fact that it has had an impact in the lives of the people who are your targeted audiences there. So is there a possibility of renewal? Yes.
We are engaging the donor, and this project was funded by EU. We are still engaging. The no-cost extension has actually provided us with an opportunity to re-engage, to say that if there's possibility of extension, we have it. But we have higher chances of having an extension, but that does not rule out the fact that we need to be prepared to ensure that in case we don't get it, how else can we continue with the project activities? And then also, in regard to target beneficiaries, we targeted leaders at the different levels, right from district up to even the LC1. And then the community members, ordinary people who are there, they know the things that are happening. So the engagement was basically between the leaders and the community members.
Okay.
Yes.
Thank you, listener. If you've just tuned, you're most welcome to this program. It's a talk show. In the studio, I have a team who are from Koboko, officials from the local government. They are talking about integrating existing projects. These projects are being implemented by PICOT. They are talking about basically integrating these existing projects into the government programs there. Yes, let me turn to Mrs. Julie briefly. We all do understand that leaders play a very big role in governance, and they need to be held accountable on issues of resource allocation, issues of implementation of several other things. What additions can you make, or what other key information can you add to the listener in regard to these projects that we are talking about here? You're welcome.
Yeah, thank you very much, moderator, once more. In a special way, I want to appreciate what PICOT has done, especially in this project of legal empowerment and social accountability. And I want to say that they have really done a lot. They have really been with us, and of course they have really been supplementing our efforts, especially in awakening the communities. And of course they have been using various approaches or various ways of passing the information. We have been having together with them barazas, we have been having together with them meetings, we have been having together with them a lot of things. But I want to say that since the project is coming to an end, as the project manager said before, that it was for around 30 months, but now it is coming to an end. But I want to say that as a local government, PICOT has been actually supplementing what the local government has been doing. But through this project, it has empowered the community to be able to know, or to be able to see what the government is doing. And through that, the communities have been able to ask. Actually, when you see that during these meetings, they will come openly that maybe ABCD has been planned, how has it been implemented, what has happened, and so on. But I want to say that since they are phasing off, as a local government, we still have a lot of plans, we have a lot of strategies that are in place that we are going to use to continue that, to ensure that the project continues and sustainability continues. Let me take us right from planning. We are going to ensure that we have our plans as we have been having for all the community. And of course, we shall also continue to give them the feedback. That is through our budget conferences. We shall have quarterly meetings with the community. We normally have meetings with the LCs where we bring all of them on board, the LC1s, the LC2s. And during that meeting or during those meetings, shall be able to also pass the information. And of course, we shall also be able to have monitoring, as actually we have been having, but we shall be able to continue with the monitoring. We shall also be having our village meetings. We shall also be able to continue with the barazas, so that we shall be able to be together with the community, continue being with the community, and also continue empowering them to be able to see. Actually, they act as a check. They see, maybe if A, B, C, D is planned. Of course, right from the planning season, when a communication is given to the community, for instance, if a borehole is going to be drilled, maybe in village A, and then of course towards the end of the day, this community will be able to ask, or should be able to ask that we were given information maybe through our LC1, through the LC2, through the parish chief, that ABCD is going to happen in this village. But we have waited. What has gone wrong? Why has it not happened? So of course, from there, of course, you will be able to give them the feedback. And we have been giving, but we are still going to continue giving them to empower them, so that they shall be able to continue. We also want to continue with them so that they will be able to also monitor the government programs, so that we shall be able to work with them as a team. Of course, so that also we shall be able to eradicate this, say that this thing is for the government. Of course, bring the aspect of ownership in the community. Yes, and continue with that. I want to say sincerely that I really appreciate their efforts. But I want to pledge that we shall continue working with them, and we shall also continue to see that the community continues to be empowered, so that they'll be also able to continue demanding, and of course we shall work with them as a team. There are many other projects. I know people have heard about things to do with the parish model, things to do with the Uganda Women Entrepreneurship Program, and many other programs that are taking place. Of course, this is a way of empowering the community and also giving them the feedback, so that shall be able to continue working with them as a team.
Okay, if you look at a project, legal empowerment and social accountability, the project is more of a call to the community. First, take us briefly through some of the key implementation strategies that were in place in implementing this project. You're welcome.
During this project implementation cycle, we have been able to actually have meetings with the implementers and also the community and also the local government. Of course, when we come for these meetings, we are able to actually, that is where the community is actually more of giving feedback to us, and of course the community will also be able to also ask the questions, as I have said before, that A, B, C, D. Okay, maybe we have a school, maybe this has happened to our school, or during the feedback meeting we are told that this school is going to be built, what has happened, maybe our teachers are not maybe reporting to school, or maybe we have these other problems. Then they will present the problems that they have in their community. Then after presenting this problem, we have leaders. Actually, we have right from the sub-county chief, the CDO, the LC3 chairperson, and other leaders. Of course, when we are having this meeting, they will also be there, and they will be able to respond to the communities as to what is happening and why it is happening like that. Of course, when something is planned, at times you may find that implementation has delayed, but it is worth explaining to the community why it has delayed, so that they'll be able to understand why this thing is like that. Okay. Yeah.
Listener, my SMS line is open, 0788-9564-94. You can drop me that message. I'm seeing people already calling my studio lines, but of course I'll pick these calls later on in the last 10 or 15 minutes of the program. This also goes till the hour of 9 p.m. Let me turn to Mr. Vincent over there. We do know that the project really aims at the community itself. Let's talk about bringing the community on board, or bringing the community into the system, especially in the process of implementing this project. You're welcome.
Yeah, thank you, moderator, and once again, listener. Indeed, if you look at what we do as a government, we are basically there for service delivered for the community. And therefore, the community participation is very central. It is in our hearts in terms of what we do for them. However, we've been really having challenges in ensuring we have effective participation. Partly, this could be a systems challenge within the government. However, we do appreciate the participation and the support from the other partners, especially partners in community transformation. Indeed, empowering the community to understand what they are supposed to receive is very central. And if we don't do that, then we are not serving the community. I will briefly say that the strategies that the organization has been using to help the community is actually within our mandate as government, especially as CDOs. Because ours is to work with the community and ensure that whatever we do for them, they are central in it. Now, for us as government, we have different strategies also in ensuring that this community participation becomes central in this project. One, as my senior had already said, that we have a whole planning process for the government where the community is expected to participate at every level. And this begins from the village, it comes to the parish, and it comes to the sub-county, where we also come with prioritization of projects. Now, at this level, if we do not, as government, strategically look at the proper participation of the community, that is where the problem usually starts. and therefore the other partners come in to check to see whether we are doing this and we are not doing that. And that is exactly what Partners in Community Transformation has been doing to ensure that there is already feedback given to the community. Yes. One of our challenges had been sometimes in terms of staffing and resources, but for us, we are saying that this is not the biggest challenge. Can we have resources that we use in the right way? So that means we need to do proper planning, we need to do proper prioritization. If we talk about community participation, how do we spend to ensure that the communities are able to understand what is taking place within their localities? Now, some of these forums that we have, I earlier on said that we have budget conferences. We also have community dialogue meetings, and currently, if I may say, some of us have been supported also by other partners in doing community dialogues. Although this was only on the side of child protection, but these are some other forums that we already integrate other issues within the community. For example, when you go to talk about child protection issues, maybe you're talking about issues of teenage pregnancies and so forth, but you realize that some of the causes of these issues are beyond the child protection issue. It could even be lack of access of information or important infrastructure that could help avoid some of these situations. Now, additionally, when we talk about improving service delivery, we also need to put in check that the resources that we put address the needs of the different kinds of community. Sometimes we only look at projects that look at the benefit of a different just a small section of the community, not really addressing the entire community in terms of their vulnerabilities. So those are some of the checks that we've been able to receive, especially from the partners, in terms of helping us address some of these challenges through the dialogue. And then lastly, I would say that let us take advantage of the different programs that are on ground to ensure that we have proper participation. I would say something small about the Paris development model, which I believe should be a way in ensuring that communities take full charge of participation. Because right now, government is saying let resources, let prioritization, let priorities be addressed at the Paris level. That means the ordinary community member who used to come up to the sub-county should be able to reach at the Paris level, to be helped by the leaders at that level to understand what they need and how they can be able to access. And that is why right now the government is looking at ensuring that there is the financial literacy done, mindset change done, and all these other different services decentralized at the Paris level. Otherwise, maybe for now, I would say all those. Thank you.
Before we get to the Kakwa version of this, yes, let me engage Mrs. Bako once more. What do you intend to achieve by integrating these existing systems into government programs?
Basically, continuity, and then also we want community members to be empowered in terms of knowing their rights to services that are available, and also their mandate and as community members, we always have a belief that we are always supposed to receive, but we also forget the fact that you have a role to play for you to achieve something. So we want to ensure that there is also harmony between the community and the leaders. In most cases, the community members, because of lack of information, they finger point at the leaders because they feel that these leaders are not doing the rightful things because they don't have the rightful information. So they begin to allege issues, and then at the end they bring some rifts between the leaders and the community members. So giving them rightful information through dialogue and engaging them to understand how the local government system works and how as community they are supposed to participate is very important. So we want to ensure that there is harmony between the leaders and the community members through active participation.
Okay, thank you. I think that is quite clear. Yes, let me go to the Lugbarra translation of the, the Kakwa translation of this, and I'll get to more of other things like all. Yes.
Yete nalungwa bayo gara sulbe na tata ingana ikla pana nde ku tokso laga di iklo kinga filana ga PICOT naga be na logui ku filana ga ku community kaya koboko katani lepe logu prito naga be kumara cha kutokude na be kuyumbe lepe boku program na naga lepe apeta kina ina logi ila ga be mutu ku koboko tenaga kaya yimunda kulepe kuna naga program of sa mutu naga meda kula ku program hina naga di tebe PICOT program na sekulu to gunade nalungu kutu na mundulo nga good governance kine kula naga dimbana ku kula naga na depa kine ku gedi ku kikole ela ga lobo nyaga karanga di sekulu togu na program na ne denga program na ne kodo mana uteki ya palo bukie lokatani bakuru kujuna ga senga maguna ina de enga tse hapa lo merikire kwenye morelo katai ona program nane ganda sekona na program nana deni gele seklo mino medana gadi seklo mino medana gadi ina program nane elira soso na didinyo gele te kona kukiko laga sekona community dialogue se lunguna nguturu kulo tajukula kasenaga karalo mindo kidi more se akija kikole elaga sekwe kini nguturu kulo kulana ga karanga akuteni kini musala se pija piesi mutu kulo tetu no piesi kasekino bodo lepe ataju na gadi program nana deni na nu i prito na ga kine deni sub county na Lobulena sub county na Kulubana ku North Division i municipality ni gatani ngona ga lepe ataju ndena na gadi ina program nana de ka sekile ilundu podu se atogu sekile ilundu podu o sekile mino na gai local government naga na meda prito na kule mane na government na ku maraki ne kule na kine ku tsuki ikitaji na gasekelo ko konda kine katani ukaranga ta kulu tuzi itogo na ngutule akutane ta kule na imetana gadi mutu kulo ko kule kasekini so kide kule na gale fa taju kine tenaga gidi ya kuinga do kule ka yanaga ku taseni kanaga aluluke lepe ataju na gadi sembana toguna program nane kukujina program na pana kukoli kilo kade gelena program na pana tongi junangu tula kuluka yuklo itaju na kuliana ga kunukara uwani kasi deliko yikine bose tikina kikola ga dinyo laga karanga taju kulia ga sikine sema mora ni karanga iberesu na gaya gele se le ngolunga baranda meeting se lunguna nguturu kulo karalu taju kulia ga sikine se ko meeting lo do se tunda meeting lo naga ngutu kulo panda taju kulia ka sekine ama do meeting lo de kulo lunga dialogue ngutu kulo se pija kara ku piesi kara lo teitu no kulia naga kara lo ingakini le tata juna gadi PICOT the NGO PICOT na togui the government kulia kuti naga kono nyara kilo konekine PICOT tina de lo togui o le pe ko do kulia kuti naga kenili kala aniweza ukine PICOT na logui bo tela ganya togu nya nyola kulia naga PICOT ina atogu iko program na ina deni o le pe ataju na gadi kukujuna ga PICOT atogu ina sebe local government na kobokona se anyola kutoke sila kilodi le pe da kupia na gadi kulepe na kikola ga dinyola ga ji ititiki na program na utuzu ngero benaga PICOT na lulfo dukango yi de local government na yi itikina na program de utu zingero na didinyo lepe adi gele na yi itikina na program na de isalaga kiklo woro isalo planning kiklo pedalo peteskaya kilo ujokulo yi itikina ngutula ka kayo kilo kukaranga kitelo tokei more o isanga lokatari ilo ngalo budget conference lo te itikina ngutukulo bangela ga kukaranga kulia ase kulia kini sedo itikina ngutukulo ikukulia na vikasi kinine isalo kisa tunda meeting lo kita atoka yo satuna meeting lo ka village ya iparesi so sub county ni kita tuna meeting lo mutukulo kukulia kasikini odo seklo ya kija kikole ilaga dolongo kutulo mundula di monitoring seklo metadu nagadi kulana ga kine dina kine ikonda beri benaga nanyarana wala ani konda beri bo kude kine seklo utu meeting lo kude kilo so mutu laga i village katayo kude laga ese lakata nikilo ulaga iwa dikata nikilo makaranga kubo ku piesi kase makara pija bodo seklo utu zingero ku dialogue kilo ibane ku PICOT naga alupodu seklo pepe seklo sukino kase budget ni katani nagadi idio gele ama kusela ga be sub county members kilo mutu la kulo kolo government kilo yo kase kokolo ki ku dialogue sila kile ku tuzingero kise suki kase lo petela ga seklo pepeda I budget la katani kilo inde seklo kulo tuzingero itikina na rinye ku mutu kulo kayo nagadi mutu kulo ku gadi ku rinyi itijana ngona ga ku karanga mindo kulo to kule ku nagadi miso leta tajo kin nagadi ipir naga ina programa nade isisi da beri ngola ga golo mutu laga kayo kulo ku umara na program de be nasenga ka ku dulunga ina project na PICOT kujina ga PICOT fana itogu nai PICOT na lulupodu okule pa lupodu yani naga project na kubagi ani bagi akani gwede kata kudekine kulia yi akuye munda kulunga selika laga Vincent ataju nagadi government na lepe kulia naga lepe mana ring a meda namba gile kine kulia nagadi muturu kulo irumbi konesi laga dinyo kayo laga makara minde kulo ngala ga bipio kilo ngala be kikoli bana ngala ga kuka mendo kona muturu kulo kine kulia naga ko kuka mende kone to iete nya nyola kunaga PICOT tapanda kata na togui ikulia na kine nye a nya nyola sana odo mure anga PICOT duwe partners kade laga kala pana kilo kobo koni kilo karanga togui ba tikina kulia kuti naga koti kigai kine ani kigai we nya nyola kulia naga PICOT na kokona kinda iki do lepe duka apia naga di tinade duga lepe ataki na naga di kiko lukude laga do itikina na program de utu zingero toto kono yikilo isukino nye isalaga iku kona planning ama lo petelika eku ujokulo lo petelika kilo de ikulu do I village katayo naga itauni na lunga sel kine I parisiu o itauni lunga ward division la na lunga kule na sub county do I district kule da kiko lo gele laga se itikina community na masugulo beri kugele maketa kuse kugele anga denga deniku leta adi sedo yakija budget conference lo se lunga la lo budget lo se lunga nguturkulo makarati pija piesi ka pija piesi makarati tituki kulana ga makaranga kuimoni kine ukula kuti naga ko konda biri kine ya makokona so uluda akweja naga di seklo tikina nguturkulo ne do biri kugele kula kuti na lepa taju kine naga di do community dialogue mana community dialogue ina de meda naga di nguturkulo boko piesi ka se pija ama ngana ngutu yi pipija ngutukulo tetu no ngutukulo nyaka kula ka sekino lepe ataju nagadi yi kodo amomora nitoke I partners kaya naga kade the UNICEF na togui kikolaga lotiu ni ngaji lotiu adidinyo bakatani o UNICEF du meda besi kulia naga lotiu ni ngaji lepe akutoku program sona dekini wonya nyola naga PICOT tapana ndiki ninga togu nai kitoketo na program nana do lepe ataju nagadi program kata na lunga Paris development model na project nana de no ajonga jinukayo o gana gamele jonga na program de kayo lepe mino meda nagadi mutula ga dukayo lo ndiki ninga kule pe rumbi kikole elaga umal lepe ujo bo mindo kitoketo na program nana de sana nyelo tena na program nana jue sukani ye tekine kulana ga na nyoko kono kukutuna ka kwa na tekine.
Okay, thank you so much for that translation there. We have about 17 minutes to leave the studio. If you've just tuned, you're listening to Radio Parties 94.5 FM, Peace of Christ for All, and this is a talk show. In the studio I have officials from a local government division that is in Koboko. We are discussing about integrating existing projects into government programs. These projects are being implemented by PICOT, And one key that we are focused on is the legal empowerment and social accountability, with targets ensuring that people in the community know their rights. Leaders are brought to accountability on so many other issues there. Of course, I'm soon going to be opening my studio lines for you to call and give us your feedback on areas that you need clarification. You can also question my guests in the studio in case you have something that you want answered. Let me turn to my last guest, that is none other than Vita. Vita, you are a community health advocate. What do you make of this whole idea of integrating existing projects into government programs? You're welcome.
Thank you once more, presenter. I remain Vita Bashir, a community health advocate for North Division in Triangle Ward. My second thank goes to PICOT as being the NGO around that has been supporting us as a district, with the neighboring districts and the community members within. It was a 2-year project that started in 2022 and then supposed to end this year June, as our coordinator said. But as it is coming to an end, we don't expect it to remain like that. Those who funded, as they are leaving it onto the hands of the community and the local government, it has to keep on going. And as it needs to continue, I am not the only community health advocate. There are many down there. Those who are listening, we should be able to do the following as a mandate to make it run successfully. And then when the donors come and find it going on, it also gives them the happiness, perhaps, to give us more support. One, as a community health advocates, we have our roles. Let us keep on educating the community about their rights in accessing services in the community. They should never be denied those rights. And the local leaders should be able to handle them in those peaceful words, that the peaceful way that they deserve. Two, as a community health advocate, because we live in the community, we should be able to attend the village planning meetings so that we also guide the community members. We should mobilize community members when there is dialogue, because in the dialogue, their participation is key. Without them, the politicians will not do. Present, I want to tell you open, some politicians survived their positions because of these dialogues.
Okay.
Because previously, what community members used to know is that budget is all in June. But they didn't know that it is spiral, where planning starts from August. It goes like this the whole year, and then implementation starts in July. But the community used to know that the budget has been done when it is ready, around the 14th or 15th of June. That's now when they know there is budget. But because of these community dialogues, the community is now aware that August budgeting process starts for the next year. Like the one that is going to be implemented in July, it was the one that they participated in. They are now aware. They will know whatever has been prioritized and what has been put down to wait for the next financial year, and then it gives them. Also in the community, we should report cases from the community that are beyond our control to the relevant authorities. We should never take the law into our hands, because down there are some issues that are really happening in a negative way. But as a community health advocate, I need not to watch and then leave it like that, no. Those are human beings. They need that guidance and they need to survive. So where those cases are there, where it is beyond, go to the next person. Go to the LC one, go to the vice chairperson, and then follow that ladder rather than picking it upon yourself and then you act. in the wrong way. We also need to monitor the government projects that are going on in the community together with them. Like, let us take the recent one, that is the parish development model, where groups are supposed to be formed in the villages, that is in the district, and then in the municipality, those are the cells. As the health advocates, we should guide the community members in forming those groups so that they become beneficiaries of these projects, though they also benefited from others like the youth livelihood and those other ones. We should not let it be like that. Maybe finally, as community health advocate members, we should also demand for feedback from the local government on what has been planned and the projects that are going on. Besides all, it will never be good when I am a health advocate member and then I am the one turning or influencing the community members negatively onto government projects. No, it will never be good. So as health advocate members, let us always guide the community members towards the government projects, and then they should own. We cause positive change towards the services. And LC ones, mostly they used to say, we don't know something about budgeting. My request is they should pick upper hand, influence the cells, moving to the ward, and then as it goes to the sub-county, the divisions, the members should be able to know what are their priorities in the community. As a village, it should be there. And then as the project is going to be handed over because it is not yet done, we should own it. Okay. For its continuity, not for it to decline.
Okay,
thank you.
So many people in our communities have a positive attitude towards this project, but unfortunately, a number of them don't know what they're entitled to, their rights, and so on. Specifically on this, how has this project impacted in the lives of the people from a health point of view?
Thank you once more. On the health point of view, in Koboko, North Division, the population is big. I tell you, through this, in the talk shows, when concerns were raised, it even forced the division to give support onto the mission health center that we have there, so that in the mission they are able to handle that large population in that accordance, because the hospital is now general for everybody who is there. Now when the population is big, through this, when you go right now, those health concerns which used to be a challenge, at least majority have been minimized.
Okay.
People are now moving in a better state compared to the previous.
Okay. Thank you so much. Listener, I want to open my studio lines right now for the calls. You can pick your phone and dial the studio number 0393 273 252 and give us that question or the comments you want to share with us in regard to this discussion here. In the studio, I have a team, officials from local government division, Koboko. Basically, we talked a lot in regard to the project, which is legal empowerment and social accountability. These are key issues in our society, in our community, issues of concern that needed to be discussed there. We have about 8 minutes, the top of the hour. Yes. Oh my goodness. I lost that one. You can still try 0393 273 252. As we wait for the calls to come, let's have a Kakwa translation of what my last guest just shared. You're welcome.
Adi project nana deni bana ki mete ibe local government o ibe members ku community ki mete na ina project de ku PICOT lupoduna ina project de ibage akida kaya kululunga na PICOT ku PICOT utuzi mino naga ikiti ke ina project nana de kulira kisoso lepe ataju nagadi do nyemeda isalaga ma project na ina da panina atikina gidi mutulukulo mama go kulana ga karanga mindo kine kaju mutukulo ridia karabaki kolaga karataji kulana ga kara mindo kine to murena lepe ataju nagadi I mutulukulo bita ibangena ga na tiro na karanga ani woro kilo ngolongu dialogue laga soso laga tine petaklo tinade isala ma project na ni pande na nyemeda mutukulo woro I dialogue ni gidi yinga ilungalo dialogue karape pija PSC kase do ibona ina dani gidi mutukula akudeni okulana gadi mindo kise utuzi ingola gabe kupolani kajudero na I lopete ku government ku bujokulo gamene lopedan kanye ani tini mutukulo tinade na utuzi ngisu mutukulo I village you pani kideso iparisini ngula desu division pana district ni so gidi lo bangena na de gidi mutula ka kayo kulo solo do apolani ngila lopete lu bujolanje so ilo ngwe gidi atikina PICOT apana angaju kwenye mutukulo iworo plan lopete lu bujolo katai.
We have a call online. Radio parties, you're live on air. Oh my goodness, the caller is not talking, but you can try. We have about 5 minutes. Yes.
Lepe ataju nagadi ina program de apanda atikina dokulo muturuka logo guma lolunga politician nikilo karanga arumbi do I kongo na bukatani atikina gidi kara kukulia kumuturuka sekilo boku mbendana yena karanga kilo sisi de kitini deri kujuna ga program nana ga panda lo lepe ataju nagadi I program nana de apanda atikina gidi muturuko de deni ki kolilaga kukisa amoka kukulia kise utuzini da dombara muturuko tutu elisi geleyo kara pa tutu mutu la be para solo wakas kuluyu do mutu la ku VHC kilo do kuluyu ku mutu la kade la gatene kai kulo be elusitu elistere gedi mutu kulo woro di office la na kine gatani bana ko jana ga program nana de akita so do mutu kulo tinadena ikuye ngunda message kilo de ngadi ngola ga game na konatro na kumetani na kulutu adidinyo kulutu alo buya ni ngolo kutuna gena lo monitoring no igidi community na tina de gidi sukulu berkata deni kulanga ni kine kulana ga leta taju bajinga isala elo de kine security kutuna ka kwana.
Thank you so much. Let's try more. Oh my goodness, we seem to be having a technical problem here. I could not hear the caller, and probably it's network. We have about 3 minutes remaining. Let me get your closing remarks, and then we can leave the studio. Let me start from here. You're welcome.
Yeah, thank you, moderator. In a special way, I want to appreciate PICOT, especially this project of legal empowerment and social accountability. And also want to appreciate the other project of skills development. They have really done a lot to our youth in terms of skills development and everything that they have done. And I say that it is my wish that this project continues, so that we shall still be working together with them. And however, I want to pledge that we shall also continue, and of course we shall do as much as we can in regard to sustainability issues.
Okay.
Yeah, so I think that is what I can say, and it's my prayer that we shall continue working with them and they will get more funding.
Thank you. We have 2 minutes in 30 seconds, please.
Yeah, thank you. Once more, I would like to say that we are committed as a government to ensure that whatever the partners do really is continued, and therefore want to thank them for building the community capacity, especially the community structures, and we believe these structures are going to help us cascade down the empowerment project. Thank you.
Yes. You can give us your closing remarks in 20 seconds. We are time so.
Thank you. My closing remark is politicians should not look at us as a health advocates, maybe as if we are decampaigning them, no? We're working all in all to make sure that the country goes successful, and success starts from the family and then it moves upward. Whenever they receive any community health advocate, they should give him or her that ample time to interact with them freely. Thank you.
Thank you. Yes, translator, you can put that in Kakwa in like 30 seconds. Yes.
Yete bana kara taju nangadise anyola ku PICOT kutogu nagalepena togu programs nakade kade kumutul kudelaga kilo apana dokae krito kata kilo ose anyola PICOT donti kina ngaji ka kilo itogole kilaga ngolaga kutagu kuku pia didio kilo ngala kilo den so sa anyola ku PICOT tuzuningero ku program nana yete kulana bana kara taju mutingina.
Yes, thank you. We have 1 minute. It's yours.
Yeah, thank you. I think I want to thank my officials from Koboko for the commitment they've made. And as PICOT, we want to pledge that much as in this particular project is coming to an end, we still have other running projects. We'll continue to work together and ensure that we can